That word cure is full of kids with type 1 diabetes. One of those pictures is my daughter. When she was in the ICU and she had tubes coming out of her, and I got there after hours and hours of time. I pushed the hair out of her face and she looked me in the eye and she said, "Daddy, fix." I searched the world for a place that I thought would find a cure for my daughter. And from the day this place opened its doors, they have never weaned on that promise. Every single day, they work for a cure for this disease. Today, I want to give you just a little glimpse of why I love this place, because what it means to my kids and what it means to you and your kids. What's really exciting to me right now is that for the first time in DRI's history, we will have 5 clinical trials progressing at the same time. Clinical trials are the studies that test promising new therapies in human patients living with diabetes. Our BioHub trials continue, and the majority of new trials will tackle the challenges of the immune system head on. So overcoming these obstacles is absolutely critical for developing a biological cure, and that is the goal of the Diabetes Research Institute. Chris, one of the things I find so exciting about this place are the people who have the closest amount of connection to this disease. You have a particular story too. What's your story?
So when I was 15 and a half, I was diagnosed with type 1 diabetes. It came as quite a shock. After getting it, I pretty much dedicated myself to the idea that I was going to do something positive to try to fix it. I went to college, studied sciences. Then in about 1996, I started looking around trying to find a place that was dedicated to curing diabetes. That was very important to me. At that time, I had my first daughter, and we found out that she was at risk for developing the disease as well. She had my genetic markers. So I toured around the country, went to different places, stopped here in Miami and met Dr. Ricordi, and I've been latched onto this place ever since.
What struck you about this building, this institute?
Well, particularly when I came here, I was just impressed with the layout of the building, with the stuff they were doing, the idea of cell transplant therapy to reverse the disease and something that was a permanent cure. Dr. Ricordi's policy of open sharing of data, working with centers everywhere, trying to work together to get the cure as fast as possible. And also the fact that we had a foundation, which was really nice, to support us in the early phases of our research. So putting that all together, it just seemed the best fit for me.
So the foundation funding is very important.
Absolutely. It's what carries us during those early phases. When we have an idea, we propose it. If it's accepted, we have a little bit of time to work on it and try to get it on the ground running and get to the point where we can submit a grant and get some funding from federal sources.
Well, for yourself and my kids and everybody else out there, let's let you get back to work.
Thanks very much, Tom. It's good to see you.
Thanks, buddy. Good to see you. I hope you enjoyed taking a little peek inside the Diabetes Research Institute today. For my daughter, for your kids, and for all those who live with diabetes. This is just a diabetes dad saying, help us take one step closer to a cure. The Diabetes Research Institute is truly our best hope.